Recovery for someone with severe burns is often a very prolonged process, and it starts really almost very soon after the point of injury and admission to hospital. Rehabilitation really starts on day one during what is often a very long acute period of treatment.
I had a fire going out the backyard and I went to pour a little bit of petrol on it to get going better, and it went back up, the flame went back up into the jerry can. It blew apart on me. And then I was on fire, but I didn't realise that I was actually on fire. Like I put it out of my legs, but I didn't realise my back and chest were. Yeah, and I was on fire. That was when I realised it was pretty serious. Then I got all these ambulances and fire people come, they ended up getting a helicopter here. Then woke up 4 weeks later out of ICU. Everyone's super caring and happy to help whenever they can. Always coming in and checking if you're all right, and it's really good.
After discharge, a patient often needs a lot of physiotherapy, reconditioning, and then reintegration in a way back into their lives. Because burn injury is often very visible to not just the person, but in their social interactions, it can have quite devastating effects in people's ability to get back into enjoying life again. So the acute challenges in the immediate and early aftermath of an injury really relate to the need for a lot of surgical treatment and procedures, extensive dressing changes. Often these people become very ill just due to the systemic effects of a major burn. Infection is a big problem during this period, which can go on for weeks and sometimes months. And pain control is also a huge feature of the patient's treatment.
Traditionally, when patients come in, they have to be treated with traditional skin grafting, which hasn't really changed for over 150 years. The skin is harvested from an unburnt area and then meshed and grafted onto the burn. Problem with that is that with massive burns patients, they have very little unburnt skin available to graft.
We're currently running a trial on bioengineered skin, which involves manufacturing a large area of what's essentially a skin graft equivalent from a very small biopsy of the patient's own skin. Using the bioengineered skin, we can definitively heal full thickness burn wounds.
So the bioengineered skin is basically growing skin in the laboratory inside an incubator. And the beauty of that is that it has the patient's cells, so it doesn't reject. And so when the patient comes in to the Alfred, we take a very small piece of skin from the patients, we isolate the cells, we expand the cells, and then we put them all together again and make skin sheets ready for grafting. And the bioengineered skin is pliable, it lasts, and it's fully functional.
Means that there is less pain for the patient, there is a more rapid healing time, and early results of the scarring associated with that treatment have been very encouraging.
For Josh, you didn't have a lot of normal, healthy skin that wasn't burnt. The difference is huge. Think about the appearance.
Yeah, they look completely different. It's all nice and neat, and
it's a lot more smooth.
Yeah, it looks like normal skin. It looks good and it's healing really well.
Caring for patients with burns is a very complex undertaking, and it involves multidisciplinary team that a very specific set of skills and experience. And we also place a lot of emphasis on psychosocial welfare of our patients. Community funding is incredibly important to support the work that we do here at the Victorian Adult Burn Service at the Alfred Hospital. The support we have does provide some of the work that the laboratory is doing in this research, and also for our clinical research programs as well. It supplements the other funding, and it makes a huge difference. It means that we can embark on further development and research to improve this product that is so promising for us at the moment.
We're hoping to continue this work and treat patients at the Alfred and beyond.
I would fund it myself if I had the money.